Nous sommes là pour le PHM, pour l'Assemblée.
Oui.
Et nous voulons ressortir d'ici avec le maximum d'informations concernant les droits de la santé.
Également sortir avec un maximum d'expérience pour pouvoir, au niveau du pays, agir pour que la santé pour tous soit une réalité.
To learn from each other's experiences and see how also the different ways of how people's health movement can be built in different countries. That this is an important contribution that people can do here beside the official, let's say, content program.
Definitely, actually, it will give us a direction, first of all, and we will be able to discuss like the current situation, the political situation, and the economic situation. So this will be able to guide us and able to motivate us to work in a better way.
My expectation at the end of the whole program should be able to push most countries to make primary health care accessible to more, especially the grassroots people.
First of all, it's going to be an exciting forum for discussing a whole range of issues to do with health. Secondly, I've come to be re-energized, to be with people that I like and respect, to recharge my batteries so that I can continue in the struggle for health and a fair and more just world. And thirdly, because Cape Town is such a beautiful city.
And I'm told that the registration numbers have now gone above 700.
Well, it's wonderful to receive people from all over the world. There's obviously a very diverse representation here. From our registrations, we think that there are people from 90 countries or more, and we have about 700 registrations.
It is true that despite some efforts, implementation of the principles adopted at Alma-Ata has not been successful. I'm very glad to know and notice that the People's Health Movement has been formed, among others, to rediscover Alma-Ata.
I have both a local and an international perspective. So we've used this assembly as a way to both revitalize South African health civil society and also to get the policymakers to hear us. So the minister was here today and he was forced to hear us. And I think he made his speech in light of what we're about. And then globally, we're trying also to revitalize the movement. You know, when we started off, it was very spontaneous. We had a tiny secretariat of one part-time person in Bangladesh. Now we have a secretariat which produces Global Health Watch, which orchestrates a right to health campaign in many countries, which organizes international people's health universities, which watches WHO in a very organized way. We've developed a lot in 12 years, but we need to develop more.